Behind me is a picture of a laceration to the pinky finger. Do not worry, this is my friend. Me turning everything into a teaching moment, I'm going to walk you through how I would chart this laceration if I were the nurse receiving this patient. I think this is super helpful for new nurses trying to learn how to chart. So for the purpose of education, I'm going to show you this laceration in 5, 4, 3, 2, 1. Okay, let's chart. But when we're charting, we're essentially painting a picture so that anybody who is reading this chart can visualize exactly what's going on. Our mental checklist, 3 things: what caused it, how bad is it, and what are we anticipating being done for this patient. This is a fantastic critical thinking list. Now from the critical thinking, this is how I would chart on the patient, but let me elaborate on every single part of it. So the first sentence is very standard: who they are and why they are here. This will pretty much be the same for any patient, any condition that you get. We state that the bleeding is controlled at this time, showing that whoever is reading this, that the patient is okay, they are not dying. He is not dire, need to be seen immediately, bleeding right now. Now, how bad is it? This is our assessment. We're being descriptive about the laceration because that will tell us our next steps of care. For example, our description is going to tell us, are we looking at surgery or is this just stitches? We're critically thinking and assessing even deeper on how bad it is in purple and orange, all while we are anticipating what is going to need to be done in red. Being able to anticipate what will need to be done is huge, and this section matters a lot. For example, I know the doctor is going to order pain medication, so I will ask the patient their pain level and if they have taken anything already. I know the doctor's possibly going to order a tetanus shot, so I'm going to ask, is their tetanus up to date? I know that blood thinners make bleeding significantly worse, so I'm going to ask him if he is on any. I know that the patient is probably going to go home on some sort of antibiotic, so I'm going to ask if the patient is allergic to anything in anticipation for that order. You get the idea. Anticipation is key. Essentially, it is all about anticipating what other members of the team will need to know about this patient. And that includes the oncoming nurse that will be taking over, the physician, the surgeon, anybody. And so what you do is you go through this mental critical thinking checklist and paint this pretty little picture.